Hello, how you doing? We're back again, and today we're going to talk about boobs. As I promised in my last video, I'm going to be doing different videos for all of my procedures, and today's video is going to be about my breast augmentation, or as some people like to call it, boob job. And today we're actually wearing makeup and looking a bit more doll-like. It's what creeps people out. Anyway, I'm on day, I don't know, 14, so 2 weeks after I got my boobs done. And I'm here to tell you what my experience was and also what you really need to know before you get them done, and also what your doctor is most probably not gonna tell you about the whole thing. So let's get into it. Okay, well, first of all, excuse my messy room. I'm obviously not a blogger or a vlogger. I can't make pretty backgrounds, but I think that's not what's important about this video. Um, where to start? I'm not sure. First of all, I'm gonna tell you how my story goes, how I did it, and then I'm gonna tell you everything else you need to know and you need to research before you get this done. For me, it was sort of a quick decision, but also not really, because I wanted to get this done for a very long time, ever since I was 14, 15, something like that, because I had a problem with, let's say, developing in this area. I had an operation which screwed up my hormones, and at a very young age, right around when I was like 13, 15, when you develop as a woman, my hormones weren't really working properly at that time. So I had nothing. Like, I had no boobs whatsoever. Uh, Not even small boobs. They looked bad. I can pop some pictures with my bra on, of course, because, YouTube rules and all that. I'm gonna pop some pictures here so you can see what I looked before I get my boobs done. Still feels weird to say it. I was A cup. I could go for a B cup just because my ribs are very large. I guess you can say they're very stretched out. Or the A cup weren't stretchy enough, the bra, so it really felt uncomfortable. So that's why I sometimes went for big cup, but I couldn't really fill them up properly. The good thing was that I knew my surgeon before I actually went for the checkup and the consultation, because I have had other surgeries done in that hospital. So that was good because I knew the doctors there, I knew the nurses, I knew the whole layout of the hospital, and I was very comfortable with it. I liked it very much. It was a private hospital, which I would recommend for most of you, unless you find a really good surgeon, to get it done in a private hospital, just because the care there is so much better than not private hospitals, I guess. So I went in for the first consultation. I really love my doctor. He is so nice. He's like my best friend. We chit chat all the time. He was very nice to me. He explained everything properly, step by step. He asked me if I wanted to show him pictures of what I imagine it to be, of what I imagine it to look like. I didn't really have anything in mind, but I had the CCs in mind. I wanted to get 350 or 380 cc's, and I wanted to get the round ones, the ones that are, you've seen them everywhere, these ones. But then after talking to him, he gives you a a tank top or like a shirt that, or a bra, I guess it depends on everyone, that you can try them under that so you can see how they're gonna look like. And 380 cc's were a bit too big for me. I didn't really like the look of that. So we decided that we're gonna go for 380 cc. And also we decided that I'm gonna get anatomical ones, which are these ones. They are, the difference is that they look a little bit more natural, so you don't really have that curve here. I still have it a little bit right here, just because they need to drop, and I'm gonna get into that. But you can see, I guess, that they go like this and they don't go like that. So that was our first consultation. He told me, you can go home, you can think about it, there's no pressure, we can get it done whenever you want. It can be 4 months from now, it can be a week from now. He was very nice about the whole process. So I think a week after that, I made the decision that I'm sure and that I want 330 cc's. So I went for my second consultation, where we did the whole process again of me trying them on. He explained what they're made of. He explained their duration, I guess, because there is a saying that you need to change your implants every 10 years. And that is true if something happens to them, but the technology since like 10 years ago or 20 years ago, when your mom got them done or something like that, is a bit different. So they're made from this gummy bear material right now, and they last a little bit longer. There are not so many complications with these exact ones. I'm gonna pop the name of the brand of mine ones right here. Also, you get a certificate with them that says they can last you a long time, and if something happens, you give them the certificate and say, well, they were supposed to last, so you need to get this fixed for free, which is still good, but I do believe that I won't be having any problems with them. Because I really trust my surgeon, and for so far I can't really complain. So after I got my second consultation done, we set up a date, and it was pretty much for the next week. And that was very exciting. As far as price goes, I think it depends on your surgeon. I don't think it makes any sense for me to tell you how much mine were. They are expensive. I'm just gonna say that. Like, you need to know that is a big investment, and you need to prepare for it. I think it depends on every surgeon for how much they charge. The thing is, the implants themselves are not that expensive. What you're paying for is the whole procedure and the work that you're getting done by the surgeon and the anesthesiologist. So we set the date. Before that, I would recommend, not a lot of surgeons tell you this, but I would recommend for you to get your blood work done, to get your hormones checked also, because that is a very important part of it, because you do know that your breasts are obviously sort of a part of your reproduction system. Obviously, when you give birth, it's going to be important for your hormones and everything to be a-okay. So just in case, I would recommend for you to get this done. They also, I think most hospitals do it when you get in, but just to be sure, get this done beforehand. So I got this in that week before the surgery. Everything was okay with me, happily, thank God. So I went in on the exact date of the surgery. I met the anesthesiologist. I went for a checkup. I went for a blood work. They settled me into my room. It was a lovely, lovely room with a lovely view. And in about an hour, I went in, got the surgery done. The surgery usually lasts for between 1 and 3 hours. Still depends on what you're getting done, because you can be getting a lift, you can be getting them put through your armpits or your areola, or it just really depends from what kind of procedure you're getting. As far for the anesthesia, if you're scared of anesthesia, it's really easy. You just lay on the table, they put like a needle in you, and you're out pretty much immediately. You wouldn't know anything, you wouldn't feel anything. I was a bit scared, to be honest, even though I've had a million surgeries before that. I never had a plastic surgery. Also, I've watched one of Shane's videos on conspiracy theories, and he was talking about how, I probably shouldn't be telling you this, but still, if I went through that nightmare, you should too. He was telling a story about how some people don't actually fall asleep when they're being put under anesthesia, and you're actually awake but your body is numb. And I was so terrified, and I was telling my doctor, please tell me that is not gonna happen, even though I've been under a million anesthesias in my life, please. He was like, oh, you're gonna be fine, just don't worry about it. Everything went fine. I woke up, and another thing you should probably do is you should get tested about anesthesias, because you could be allergic to some types of anesthesia. I am, and I got a test beforehand, but every anesthesia can feel differently. And from my experience, I've really been under a million anesthesias, and some do feel different. When I woke up, I was really, really cold, and it hurt a lot. Like, I have a very, very high pain threshold, but I was in so much pain. Like, I've had huge surgeries done on me, and it didn't hurt as much as this did. And the nurse was next to me, and she's telling me, I did give you painkillers right before you woke up, so you shouldn't be that much pain. How much does it hurt from 1 to 10? I was like, oh my god, it hurts like 8. I really, really need some painkillers. And they gave me some more painkillers after that. So after about an hour after I woke up, I started feeling a bit better. My body temperature got to normal, and I wasn't in so much pain, but I guess it was just the shock of waking up. After I woke up, it's like I didn't really care. Like, I was in so much pain, I didn't really care. And like an hour after I woke up, my surgeon came into my room, and he's like, do you want to see them? Like, I really don't care right now. I'm really tired, I want to go to sleep. And you're like, but no, you have to see them. So about an hour after I woke up, they sat me up, and he came with me to the bathroom. So he showed them to me, like in complete shock, as I wasn't prepared to see this, because like I'm used to seeing my body a certain way, and they looked very different. Plus, you need to know this, after surgery, they look weird. First of all, they're very, very swollen. Second of all, they're like glued to you, and they look very unnatural. But maybe after a day or two, you're gonna get used to it. It's gonna start looking a bit more normal. Even now, they don't look how they're supposed to look, but it's been just 2 weeks. So yeah, I stayed overnight at the hospital. They gave me some more painkillers. On the next day, I was fine, I guess. And then I went home. They gave me just antibiotics. They didn't give me any painkillers. I was taking Advil. Which, by the way, I researched that, and turns out that some patients react to Advil as some patients react to morphine. So get yourself some Advil. It did really help with the pain. some other things that have happened. Let's see. I've been getting. You can get nerve damage, and you should know that. You can get nerve damage around your nipples. You can get your nerve damage around your muscles, and I got nerve damage right here. I still can't pull this arm up, like right there, where that muscle is. So I can lift this arm up right now, but I can't lift this arm up because it hurts. My doctor told me that that's gonna be fine. It happens very often. It's nothing to worry about. He prescribed me some vitamins, which are just vitamin B, like all of the variations of vitamin B, so the muscle can heal quicker. Also, yeah, I did go for under the muscle, where they put the implants under your muscle. They like cut around it, lift it up, and put the implant. This is the harder option. Just for healing, it's gonna take a longer time to heal if you go for under the muscle, but in time they look more natural, they look better. They don't really do over the muscle that often, but I guess it is your choice. If you want to get it done, you're gonna heal much faster. But I'm gonna post some picture here. You can actually see them. When you go for over the muscle, you can actually see the implant, and it looks really bad. So I would recommend for you to go under the muscle. Also, you need to know that you will need time to heal. The overall time, as they all say, is 6 weeks for complete healing. You can't do pretty much anything for 6 weeks. It's not recommended for you to drive. You can go to work, but you can't really lift anything. You can't do any exercise or just anything that's gonna put pressure on you. So I'm on week 2 now. I still feel very tired, I guess. I'm still getting used to them. Really love them right now. I guess you can see, it's funny how every time I'm wearing something Batman, I never talk about Batman, I always wear something about Batman, and you can see them from the side. I'm gonna pop, I guess, some pictures so you can see better. What I am now as a cup size, if that matters, is a double D. You can measure that right after you get your surgery by just taking the measures, but keep in mind that you can't be wearing any bras with underwires, at least for 6 months after your operation. Another thing is obviously the sports bras. For the first 10 days, I was with that medical bra. It's just like a black sports bra that hooks in the front. But my doctor told me that I can be changing my bras just as long as there's some sort of, sports bras like this one. It's very important for you to keep your skulls from any pressure or clothing or just so you don't hurt them. What else? Oh yeah, you have to wear, I still have it here. Oh, this is the most annoying thing ever. You have to wear this band that goes like, where is it? And goes like this. And this is just so they can drop faster and they can be pushed down. My doctor told me that I have to be wearing this band on and off for 6 weeks. So I wore it all the time for the first 10 days. Now I'm just sleeping with it mainly, just because I'm sleeping horizontally. And they need to be pushed down. Also, some doctors gonna tell you that you need to be sleeping up for 6 weeks, and that really depends on you, but I am a very pretentious sleeper. I can't sleep up. I have to sleep really low. And I also can't sleep on my back really. I used to sleep a lot on my belly and on the side, and right now I'm being able just to sleep on the side. Still can't start on my stomach, but what my doctor told me, and also what I found out, is the quicker you learn to roll yourself on the side, the quicker you're gonna really heal. So just because you're making your muscles get used to it. Your muscles need to stretch over it and they need to start feeling normal again, which is gonna take some time and it's gonna be very uncomfortable. And as I said, you need to take your time. You need to know that you're gonna have a month and a half of which you're not gonna be feeling very comfortable in your own body. And let me tell you, you never realize how important are your chest muscles for your movement. Like for the first 2 days, because I wasn't taking much painkillers, I couldn't even stand up. I realized that when I stand up, I actually use my chest muscles. You can't lift your hands, you can't dress yourself, you can't wash your hair because it hurts. And yeah, you're gonna have 5 days of not much fun. Yeah, also you need to be very careful with lifting your hands and hand movements because you do have stitches, like all of your muscle underneath, right? All of this is stitched up. Even though your scars are just right here, your whole muscle is stitched up. So you do need to keep in mind that underneath the surface you have stitches and it is an open wound and you need to be careful. Also, what you have to keep in mind is that every silicone implant needs to create some sort of a capsule around it. So that's also not going to be very comfortable. It's going to take, again, about 6 weeks-ish for that to happen. Right now they feel a bit weird. I'm still, I listened to one doctor say that it takes 21 days for you to get used to a new house. And it takes 21 days for you to get used to your new boobs. So I'm still not on the 21-day mark, but we'll see how it goes. I really like how they look, even though they still look fake. But they feel a bit not comfortable. They feel like you can't really feel the implant. They're not heavy, but there's some sort of just like uncomfortable feeling, like there's something different with your body that you can't really move much. Okay, so we're gonna go to the part of what your doctors are not gonna tell you before you get the surgery done. The first thing is that it is gonna hurt. A lot of people say that it's a 24-hour thing and it doesn't hurt and it's all fine. That is a lie. Like if you're very properly medicated and you're on very good painkillers, that is gonna take the pain away. But it is still going to hurt, and I do not recommend for you to be on very heavy painkillers because obviously you need to think about your liver. They are not very healthy. Plus, you're also mixing those painkillers with antibiotics and maybe other meds that you're going to be on. So you need to have some balls for it. I know in America they give very proper painkillers, but not here in Europe because we're tough bastards. So do keep that in mind that it does hurt. Another thing that most doctors don't mention, and I would recommend for you to ask about, is when depending on if you have kids or if you don't. something that my doctor told me is that usually if you don't have kids and if you go for a bigger implant, the chances that they're gonna start sagging after you give birth are bigger. And the bigger your breasts are naturally and combined with the implant, so pretty much the bigger you go, the more they're gonna sag if you are planning on having kids or breastfeeding those kids. Another thing you should ask is how are you gonna be, or if you're gonna be able to breastfeed after you get the implants, because my doctor told me some horror stories that some doctors actually cut to the milk tubes that you have in yourself. I know that's like a little bit TMI, but still you need to know it, which was very important for me because I do want to have maybe kids one day. If I decide to have kids one day, I would want to have that option. So he made sure that obviously everything in that area is a-okay. Another thing you need to know is that you might get stretch marks. Again, if you have very small breasts before that, and if you go for a bigger implant, there is a very bigger possibility for you to get stretch marks pretty much in that area right here. Also, what my doctor told me, usually my doctor was very, very nice to explain to me that it doesn't really work like you go there and you say I want 600 cc's, even though you have an A cup and you have no breasts at all. It also it is worked by your frame. Everything is measured very properly. The doctors should measure how much space you have available right here. I'm sorry, my dog is mad at someone. So anyway, he measures your everything is measured from your nipple. So he measures the space between your nipple and that area where your boob ends right here. And he also measures the space between the nipple and where your boob ends right there. That's before you get the implants. And they usually should have charts which say by this space how many cc's you're able to get depending on that space that you have available. And lots of doctors don't want to disappoint their patients, obviously. So there are girls that walk in and say, well, on my makeup, I want 600 cc's. And they say, okay, that's fine. We're going to make it happen. And it is possible to make it happen, but you can have much more complications if you do it that way. They might end up being different in sizes. They might end up being too high or too low or too saggy or, as I said, stretch marks. So keep that in mind. I know some people want to get them really, really big, but you need to, it's probably better for you to get the right amount for your frame and as much as your body will allow you, just because you're gonna heal much faster like that. Um, what else is there? Oh yeah, another a bit TMI thing, but you should know that just because it happened to me and I was very stressed out about it. So they recommend for you, my doctor at least recommended for me that you get your surgery right after your period ends, just because you won't be losing that much blood when you're on your period or right before it comes. You will probably be losing much more blood, and they might put drainages right here, which are like tubes that are like inside of you, which like suck up the excess blood out of you. So keep that in mind. If you don't want to have drainages, just do it right after your period ends. Another thing is that I got it right after my period ended. And 10 days after I got my period again. So I got it about 10 days earlier. And I was really stressed out. I'm like, oh, why is this happening? That's not normal. I started freaking out, obviously Googling things that I wasn't supposed to be Googling, and everything in Google is cancer. So I called my doctor and he was like, that is normal. Sometimes that happens just because we stressed out your body. Your body is there's something foreign. There's a foreign object inside of your body, so your body is fighting it. Just like I said, it's creating that capsule, and a lot of things are happening inside of you. And sometimes that is how your body reacts, and you might get your period a bit earlier. Um, so just keep that in mind. What else? Just the main things are really, it's really important for your bra. Don't ever wear bras with underwire for 6 months because you can damage the incisions. Another horror story that there is, and you need to know that, don't do any exercises, don't push yourself even if you feel fine, because I feel fine right now. I probably can start doing some push-ups right now and won't feel a thing, but that's not how your body reacts on the inside. You need to take care of yourself. Just because your scars can, from too much exercise or too much pressure in yourself, they can open and you can lose your implants. That has happened to a big percent of people, that they put a bit too much pressure on themselves, either by working out or just lifting heavy things or just moving their arms too much, and the scar starts opening little by little by little, and the implant gets infected, and they need to be taken out, which means you're losing your money for nothing, and you're getting two surgeries for nothing. So be very careful. I know you're gonna love your new boobs. I know, I love mine too, but you just need to take it slow for the first 6 weeks to 6 months. You can start working out around after 2 months, I guess, and slowly get back into your life. I am lucky that I don't have a job, real life job right now, so I can lay on my ass all day. Another very important thing is you need to walk, like just go for walks, either around your apartment or just in the neighborhood, just to the supermarket, just because they need gravity. Something they need to do is they need to drop. And that is that they need to create that curve here, because mine haven't done it there. They're starting to do it. Like you can see right there that they're kind of folding. So they need to fold just because that's how natural boobs look. And that's how most surgeons do it. And that's how your scars won't show. And that needs gravity. If you lay down all day, it's gonna take much longer for them to go down, and they're gonna be looking a bit fake for longer. And I promise you, they're gonna look really good, because I've seen boobs that are like around the 2-3 month mark. They're gonna change a lot, but they're gonna start looking better and better and better. I promise you, even if you don't like them in the beginning. And another thing is, if you think they're too small in the beginning, that is because they are very tight. Your skin is very tight, and everything is gonna get looser and better and more natural. And if you think they're too small, give them time, because they're not gonna look like that after 3 months. Another thing that my doctor tells me, they're gonna usually give you a choice of 3 sizes for CCs. I had the choice between 290, 333, and 380, just for my frame and what my body could take. My doctor usually tells me that a lot of people want them bigger after they get them. I'm really happy with mine. Actually, I think they might be a bit big, but they're gonna change, I'm sure. I really like them. I for sure wouldn't want them bigger, is what I'm saying. But keep that in mind, that apparently lots of girls have that problem where they want their boobs bigger at the end. So maybe go a size up. Another thing, your back is gonna hurt. Yeah, I think that's a done deal. I think you know that your back is gonna start hurting just because you have a little bit more weight. But what my doctor told me is that you're gonna get used to it. Just like lay a lot, get massages. Another thing, yeah, what my doctor does. My precious, precious doctor. What my doctor tells me is that about 3 weeks ish after your surgery, you can go to special breast massages where they help the muscle relax and it speeds up the process of them feeling a bit more natural and for the muscle to heal. He told me that I'm healing a bit faster than usual because you know I'm special. Uh, and I probably wouldn't be needing the massages, but that is an option. That's something you might research if you're a bit more in pain or if they feel a bit too tight. There are such massages that you can get. I think that's it. I've been rambling for 40 minutes, and that video is gonna be a bitch to edit. Um, I can't really think of anything else. If you have any questions and if you're thinking about getting this done, um, tell me, message me, comment down below. I'm gonna be here for you. Anything that I can share, I will. I wish you luck, and I'm sure they're gonna look great at the end. Um, yeah, don't be scared of it. It's nothing like I know I put on a horror story show, but it's not that bad, especially for a lifetime of enjoying them. Another thing that I need to say that is gonna be repeating myself from my other videos. Just make sure you're doing this for yourself. Don't do it for anyone else. Don't do it for your boyfriend, husband, girlfriend, wife, whatever. Just do it just because for yourself, just because you want to look in the mirror and say, damn, I'm a sexy bitch. And otherwise, just enjoy them. Just do you, boo. And yeah, my next video is gonna be about my nose fillers. Let me tell you something. You can look at my gorgeous nose right now. Let me tell you something. The nose fillers were a much easier procedure. So the video is probably gonna be a bit quicker. Um, but I just wanted to put that information out there just because I know that I needed it when I was getting those things done. And if you need it, I'll be glad to help you. Thank you for watching so much. I'll see you on the next one, and I hope you have a great day, night, or whatever. Bye.